Alexander from North Tampa has a great question for you, Dr. Kirkpatrick.
Okay.
He says, I don't understand how you can support a full set of teeth on only 4 implants on the top and 4 implants on the bottom. Does that mean he's only going to get 8 new teeth? How does it work?
No, that does not mean you're only going to get 8 new teeth. So the way the system works, and it's kind of a little misleading too, I do a little bit more than 4 on the top. I typically do 6 always on the top and typically 4 on the bottom. And there's good reasons for that. The bone quality is different between the upper and lower jaws. So it used to be called the all-on-4 procedure, where you would, surgeons would do 4 implants on the top, 4 implants on the bottom, and you'd have a full bridge secured on the 4 implants. Now, the more we know about the bone quality between the upper and lower jaws, most of the recent studies have shown that it's better to do 6 implants on the top for more stability long term. So I typically place 6 implants in the upper jaw, 4 implants in the lower, and the way it should be shown on the monitor now that you can kind of get an idea of how that works, but it's 1 bridge secured on those 6 implants on the top and 4 on the bottom. So the way that it kind of evenly distributes the forces, you don't need to do 1 implant per tooth. You can do the 4, and it's actually ideal to do that with the lower jaw and the 6 on the top.
So how many teeth does the typical person have?
Not counting wisdom teeth, there's 28 teeth in the mouth. And when they started looking at how many teeth should we put on these bridges to replace everything, they try to go back to the second molars. Most patients could not tolerate that, so we stop them at the first molar. So you get 12 on the top and 12 on the bottom. And I've had patients that, including my father-in-law, who I did this procedure on, and we extended it back to the second molars, and he couldn't tolerate it. It gagged him. So he was thinking that, well, I want the same teeth that I had.
Yeah.
But just having the 12 over 12, that feels like, and you can't see it from a cosmetic point of view, but more importantly from a functional standpoint, there's no issue chewing with the 12 and 12. Most patients feel more comfortable with that.
So you are walking out of here with a full set of brand new teeth, and it's just in a day?
Yes. There's a little prep work that goes in before that, but the surgical part, from going from how you present to the office to leaving with new teeth, that same is in 1 day.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.